Hi, congratulations on being a new independent provider. We have prepared this video as a new provider training to help you as you start the realm of provider world. We have documentation training and we'll overview our handbook and also overview the billing. I am Kathy Borders in provider relations, and we also have Amy. I'll let her introduce herself.
Yeah, hey everyone. Amy Winkler, I'm provider relations as well. We're excited to have you as a new provider. So I guess we'll go ahead and jump right in. And we're going to start with the UI MUI and give a brief overview of what that is, and then also go over the documentation components of that as well. So we'll go ahead and pull that up for you. Okay, so first document here is going to be the incident report form. So anytime you are working with an individual and an incident occurs and it involves the health and safety of the individual, you're going to want to complete this document. So you're going to list a lot of the demographics of who, what, where, when, why, what happened if there's injury, go into detail and who was injured, what part of the body. Just as much detail and as descriptive as you can be on this is very helpful. Um, and as you see, as Kathy scrolls down here, you'll see the different components. It's pretty self-explanatory, but it's going to go over each component of what we're looking for. There's the type of notification that's made. We'll dive a little deeper into that in just a little bit on who you need to notify. So again, you'll just always want to complete this when an incident occurs and keep a copy for your record. And you're also going to be submitting this as well. And again, we'll go into detail more about that. This section you'll see is for if there were injury, you're going to complete this section and highlight, circle, kind of describe where that injury is. Cause and contributing factors, that could be if someone fell, what caused that fall? Did they trip over something? Is there an unevenness in the ground? Kind of just diving into what that led to, and then preventative measures. How can we prevent that from happening again? So as we scroll through here, the next section is we'll start with UI. So what is a UI? It's an unusual incident. So it's any incident that is unusual to that person. So say an individual kind of just bangs their shoulder into a wall or knocks into a table. If there's no like significant injury from that, you do not need to follow this process or complete this form. Say they fall and they gash their leg, they bust a tooth out. They go to the ER, urgent care, there's a rights code violation, med errors. Those are the types of things that would be a UI because it is more involved with health and welfare of the individual. So that's what a UI is. So you would submit that incident form that we just reviewed. That would go to the SSA. So you're going to want to email that as soon as you can to that SSA, ideally that same day, if not the next day. And then once we scroll down, we're going to outline what an MUI is. An MUI is that major unusual incident. So it's those more significant, injuries that might occur. And you'll see there are several different categories on here of MUIs. So this does a nice layout of, where this fall and your reporting requirements for, which category it is. So these top section categories here, you'll see verbal, physical, sexual abuse, neglect, all those listed in this kind of gray box. You're going to want to follow those reporting requirements, that timeline that's highlighted next to that. So with these specifically, you're going to want to reach out immediately to the county board within 4 hours. We do have our phone number there for the intake and our email, mui@butlertv.org. If it's after hours or holidays, feel free to call that on-call phone. It's 513-867-5913. And then as we scroll down, you'll see this other section of categories here, MUIs. You don't have to do the 4-day, but it's still the same day you got to make contact. So this is a great sheet to refer to kind of see what your reporting requirements are, who to send it to and when. Down below there, just as a reminder, you'll still have to submit that instant report for all MUIs no later than 3 p.m. the following business day. And again, there's that contact information to send that in. And as we discussed with UIs, so you just go to the SSA. So there's not that extra layer of sending it to the MUI. Okay, and this sheet does a great job of kind of going more specifically into MUIs. As we scroll through, we'll kind of focus on the provider section down a couple pages. It's a great snapshot of what that, there it is right there, that process, what that looks like. So your first action is just to make sure that person's safe and healthy. If they have a legal guardian, you're definitely going to want to reach out and let them know the incident. Parents as well, talks about notifying county board as we discussed and when to do that for certain categories. Also law enforcement or children's services, if it's applicable, you'll want to reach out to them as well. So you're going to want to again share that written incident report by 3 p.m. on the following day. And then there are a couple forms that all providers are required to document on in relation to UIs and MUIs. So we'll go over this first one. It is the unusual incident report log. So this is the monthly log. Up top there, you'll see provider facility. That's where you're going to put your name, month, year, and county. So there's a couple ways you can do this. You can use one form per month. So in which case you would put October of 23 or, whatever month and year you're looking at. Or you can do one sheet for the whole year and put the months as the arrow is going down there along the side, all the months down there, and you can use one form for the whole year. Just whatever works best for you and what you're most comfortable with, just as long as you're capturing that data. And so if there are no UIs, you're still going to want to list that there's none. You're still required to report on that monthly. So anywhere on here, typically, like if under the name section there, in the boxes per month, if there are none, just write no UIs. Obviously, if there is, we're going to want to fill all that information out there. You can disregard that UI number, but you're going to fill out the name, date, injury, location, all that good stuff on there. But just as a reminder, even if there are no UIs, you still have to maintain, keep up with this per month. Down bottom, you're going to sign. Title can be independent provider. Trends and patterns, we're really looking at anything that's occurring 3, 4, or 5 times. Something reoccurring. So if that's not applicable, you can check no. Say someone's falling 4 or 5 times in a month. You're going to want to check yes there. And then, actions taken to address what's going on there and how we can prevent that. As far as submitting this, you'll want to keep this in your records. And then the county board is required to reach out to every provider once a year to request a sampling of the UI log. So typically I'll reach out and ask for 2 months worth. So you'll get an email from Kathy or I once a year asking for specific months, in which case you'll want to submit that in, and we'll have examples and give some follow-up emails and reminders as well. But in general, you want to keep this in your records. Okay, and the next one, so that was UI monthly. This is going to be the annual report. This is the MUI, so this is once a year for the MUIs. You're going to want to put your name up top there. We're looking at the previous year when we complete this. Next one will be January. We'll send out January of 24. So in which case you're going to put 2023 there. So we're always looking back at previous year. And then really, we go back 3 years. So even though you're new, you're probably going to only do the previous year column, but as your season, you'll complete the other years as well. So if there are no MUIs, you're going to want to put zeros on this form. So there would be a 0 in that right where that cursor is there. And then if you scroll down in that whole graph area, the table, you'd put zeros all the way down in every category if there were no MUIs. If there is, you're going to want to put a 1, obviously, in whichever category that falls in. And then the rest of it, especially second page, is really, again, kind of hitting home with those trends and patterns. So anything that's reoccurring, that's where we're going to address that here. If there were no trends and patterns, you can leave this entire section and page blank. Very bottom is where you're going to sign a date. And again, just as a reminder, this is once annually. The county board will reach out as a reminder when this is due. And we will also send out a reminder when the monthly UI is due as well.
All right.
Yep, I think that's it for UI anyway.
Great. And we send all this an email as well, so you'll have it. This next section I'm going to go over, we really recommend even printing it or saving it to your computer, because it's a great guide. It's 21 pages long, so it's kind of long, but it has a lot of great information packed into it. This first page is just kind of a welcome. So it does have a link to our website, and then also Amy and I's contact information on it. But that is also over on page 3, which I'm going to scroll to now, just skipping over the table of contents. That's a quick later on to refer back to. But here on page 3 is a really important page with everyone's contact information that you'll probably ever need working as a provider. So Amy and I are there again. And then also we have the SSA department, the main line to reach that department. Also the MUI reporting line and email is here again for you. So it's nice, it's all on one page for a quick reference. We also included DoD's phone number. If there's questions or you can't reach one of us, they are an option to call. You'll just need to know what department you'll be needing when you call them. We also included Ohio Medicaid. Ohio Pays is who provides your payments, provides your 1099 at the end of the year, would have invoices for you, things like that, anything related to payment. We also included the phone number for EVV, electronic visit verification, or send data, the phone number for them, as well as a email for you to reach out to them with questions about that service, which applies to anyone doing homemaker personal care and PD, HPC, and waiver nursing. And then lastly, GT Independence, which is for services, participant directed services, their phone number and email as well. All right, so on page 4 here, the first section talks about, as a new provider, if you don't currently have a client and you're going to be in need of looking for someone to work for or multiple clients, this is a quick link to our provider portal. Here in Butler County, all of our need requests are posted in our portal. And so as a certified provider, you have access to that. We will have entered you into that portal, and you should receive an email to get that activated. As soon as you're activated, setting up a password, you'll be able to log right in and look at the current requests for services, or RFSs, posted. There is a video link here to help you navigate that portal. And just wanted to point out here that by applying for an RFS does not guarantee that you will get contacted or have an interview or chosen to be the provider. There are a lot of providers often applying for each RFS. So sometimes a family or a team might be familiar with a particular provider and choose them based on that or just other reasons. So just keep applying. We also want to make you aware that every county handles their requests for services differently. So if you are interested in working in any of our neighboring counties like Warren or Hamilton, you'll want to reach out to each of them individually to get into their list. Some counties have portals like us, others have just like an email list. So you want to make sure that you reach out to them to do that. So after applying for a request for service and you're interviewed and you're chosen, you will meet with the team, which consists of the individual, the guardian, the SSA, and you will talk about what support you're going to be providing, and you will be added into the individual's ISP, which is the individual service plan. And so in that, it will detail what services you're to be providing, which will also help you as you're documenting, which we will get to in a little bit. So all of that, the ISP is really important. You'll want to have a copy of that as soon as that is created and you're added to that. And it points out here, as always, we'll probably say it too many times today, but if you ever need help or have questions about any of these components, make sure to reach out to Amy and I. We are always happy to help with this. Page 5, the next section talks about electronic visit verification, which is through SANDATA. So this is a requirement. It's required through Medicaid for anyone providing these services here that are highlighted. I mentioned that earlier, so HPC falls under this, as well as participant directed HPC and waiver nursing. So if you're providing those, you will be required to use EVV. You should have taken the EVV training during your certification time. So hopefully you're familiar with that and know what the system is. It's basically a clocking in and out while you're working. You're going to be verifying your time that you're there, that the individual received the services that you document and bill for. So it's not optional. Their Sandata is very good about helping providers get set up in that. So if you have trouble with that, that phone number on page 3 will be a great guide, great help for you. Because during your training, you started the first part of getting yourself set up. You should have received an email that will have a link that you need to then follow to set yourself up completely in that. And then you'll be able to then add clients to yourself within EVV. So with EVV, you can either get an app on your phone or you can request a device from them. And some providers choose to call in while they're working to document their hours. So this does not take the place of billing. You will still need to do that, which we will go over in a little bit, how you bill. But you're basically doing 3 things. You're clocking in and out with EVV, you're documenting on your doc sheet what you're doing and when you're working, and you're also submitting billing each day that you're providing that service. So there is a link there for more information about that. Moving on to some basic pointers about documentation and requirements. We have a link here. This is a really great link to the rules on DoD's website. So every service and support has a rule attached to it. So you can click here to go and review those. If you have questions or want to know more of what is required from you as an independent provider. There's also a rule specific to independent providers. So it's a great resource for you to be able to go and to keep up with that. There's also 2 links here to take you to getting documentation templates. We will have sent those to you for your current services or the services that you're certified in. But here too are links to be able to get those documentation templates that you will need to document with. Some things to remember is that you want to keep your documentation in an accessible location. Documentation is not, your invoices and everything you submit for billing is not considered documentation. It's a separate piece. You want to update your service documentation whenever there's a change or an update made to the ISP. If your supports and services that you're providing changes, you want to make sure you update your doc sheets as that happens. And that includes the outcomes as well. This is kind of surprising for some providers that you will want to keep all your documentation records for 6 years. So that's quite a long time. So a lot of providers at the end of the year, they will take out the year's doc sheets and things out of their binder or their folder, whatever they're using, and put them away in a secure location, kind of like a filing cabinet or something where they can be stored to be maintained for those 6 years, and then start over fresh with new sheets for the new year. If you are working with a participant directed service and you're working with GTI independents through that, you will want to make sure that your documentation with them has all the required elements, because they require their own documentation, but it is your responsibility to make sure that it's in compliance. Don't count on them, what they say, I guess. Last note about this on this page is personal funds. So as a provider, if you are identified in the individual service plan as being responsible for managing an individual's personal funds while you're working, you will want to follow the personal fund rule, which is linked here. If you have questions about that, I encourage you to reach out to Amy and I to get more information about that. The next 3 pages, I'm going to just scroll through very quickly. These are pages we provided if you were to ever want to make your own documentation sheets. These are the components that are listed in rule as being required on those doc sheets. However, all of the doc sheets we've given you, have these required components. So we really encourage you to use our sheets, but some providers like their own system. They may prefer Excel or something like that. So you're welcome to do that. Just be careful and make sure they have all the components that are required.
All right, so back to MUI/UI. I know we touched base earlier with that, so I won't spend a lot of time in this section, but again, it's just a great spot to have everything in one document for you to review and refer as needed. So it's going to list that MUI rule there in case you want to hop in there and take a look at that. Monthly UI logs, this is another reminder to keep those monthly, even if there were no incidents. So it's going to detail that in that section there. MUI annual analysis, again, completed once a year. It's going to outline what it's due. But just again, as a reminder, we will send those emails out, before and during and after when that is due. So again, that's once a year, and you'll want to maintain that as well.
All right, moving on to billing. So after we review the handbook and documentation, we are going to hop over to billing so that you can see what that looks like. But just a couple of notes about billing is that you want to make sure that you're only billing for services that you are authorized to provide and are documented or identified in this individual service plan. You'll want to make sure that the day that you bill, your authorization has started. If you bill for a time when you're not authorized, those claims will be denied. If you are providing the participant directed HPC, you're working with GTI independents, and you do not submit your own billing claims if you're working with them. There's some information about getting a billing or having a billing agent. You can submit your billing as often as you'd like. Some providers do it every day, some do it once a week, some do it once a month. You actually have 350 days from the date of your service to submit your billing. So a really long time. That would be a lot of work to submit almost a year's worth of claims. But if something happens, that flexibility is there for you. It's important to note that all billing claims are pulled into the system for processing at noon on Wednesdays. So every Wednesday at noon, anything that's been entered into the billing system since the previous Wednesday at noon will be pulled into a pay period. So all those claims get processed and will be sent over for payment. However, it takes about 3 weeks or 21 days for that payment to reach you from the day that it's pulled, because it's going through multiple places like DODD, Medicaid, the bank, all those things. So it takes a little while for that payment to actually be received. If there's any issues with your billing claims, it could be denied, and you'll receive an error report so that you can make a correction, adjust that, and then resubmit it so that you can get paid for that. So there is a weekly billing report available each Friday in the billing system, which we will show you in a little bit. And that's the Friday after you have actually submitted claims for that week when it was processed. A little confusing, but we'll go over more in a little bit. There's some instruction link that you can go to for more information. This is what the billing screen looks like, which again, we're going to look at here in a little bit. But this is all claims are submitted on the DODD website through an app there. So we will kind of leave that for now. Continuing though, page 11, talking about reimbursements. You will receive payment for all services that were billed if they were from an approved plan with an approved claim. There was no taxes taken out, so you receive the full amount for that reimbursement. So we recommend that you consult with a tax professional to find out what that means for you, if you are going to have to owe taxes at the end of the year, or if there are any kind of tax exemptions for you. You'll want to make sure you reach out to a tax professional about that. If you are providing the services that are through GTI independence, you're going to receive a paycheck with appropriate deductions taken out. So it is different with GTI independence. They do take out taxes and things. So just to note that. If you ever are in need of a pay stub to verify income, you can actually get those in 2 different spots. So within the billing system on DoD's website, there is a place to get reports. So it'll show what you were paid for the week. You can print those out or save those as a weekly report. You can also go to Ohio Pays. They're the entity that actually provides the payments. Sorry. And so there you can go to a section to print out invoices. So it'll be a more concise summary of what you've been paid. So those 2 places are helpful there. At the end of the year, you're going to receive a 1099 from Ohio Pays instead of a W-2.
Also, providers are required to know what you're authorized for and to kind of stay within that budget, that limit of, how many units you have. So you should have also received an attachment for how to view a clause. That's how you're going to go into the system and DoD and see what your authorization is for. And just a reminder to keep track of, and you'll be able to do that on those doc sheets, but keep track of what you've been utilized, what services you provided. Because if you run out of those units, that's it. You won't get paid. So if you run out early because you're working more than you should, you will receive an error on that. So just make sure you're monitoring what you're authorized and how many days that you're working as well.
The next section is about training. So during your initial certification, you completed the initial independent provider training. So each year hereafter, you will want to complete the annual training. That can also be found in My Learning on the DoD's website. So it's called the annual independent provider training instead of the initial one that you completed during certification. So you have the entire calendar year to complete that training. So that starts from January 1 to December 31st of the year. It doesn't go by 12 months, it goes by calendar year. So that gives you a little flexibility that way. So that annual training is going to be 8 hours of training. So there is that module on My Learning that has the full 8 hours that would satisfy that requirement. And those requirements are kind of broken down here for you into a 2 and 6 hour section, because some providers during the year participate in other trainings where they can actually use those extra trainings towards part of their 8 hour. So if you're doing that, you have note that there are 2 hours that DoD requires you cannot substitute anything for. You have to complete these 2 hours on the My Learning app. So that is listed here. And then the 6 hours is where there's some flexibility. There are 6 hours of trainings on the My Learning app, or you could substitute things that you've done, like the MUI training Butler County provides, or some guardians have, if you're completing guardianship training hours, you could count that here as well. There's just different categories that those would want to fit into. The other thing, and the important thing to know about this is there's not any reminder or alert to tell you to do that. So you'll want to make a note of that in your calendar or your phone to make sure that you remember to get that done. It's your responsibility to be in compliant with that, as it is required by rule to have that done. CPR and first aid also must be kept current, and so that needs renewed every 2 years. Butler County does provide that at our office. We can help you get in touch with our nurse who can schedule that with you when it's time to renew. So that's done every 2 years. Again, no reminder or alert will happen when yours is expiring. So you want to make sure you keep track of that to stay in compliance. Here on this bottom of this page is a list of exemptions from training. It's kind of a rare thing. So I'm just going to kind of scroll through that quickly. Page 14 talks about an opportunity that you have as an independent provider if you are providing routine homemaker personal care. There is an opportunity to earn an additional $1.56 an hour by completing the competency longevity add-on. And that is done through DoD. There are 2 components to it. One is having work experience. I guess I'll scroll here. So that can be as an independent provider or as an agency provider DSP. You'll just want to have documentation of your years of experience doing that. You have to have 2 years of full-time work experience or 4,160 hours. So there's a form on DoD's website that you can get filled out if you need documentation rather than a letter from your employer for that. There's the second component of that is training. So you have to complete 60 hours of training outside of the regularly required annual training. So it's quite a bit. Some providers will work on a little bit at a time, a few, so much every year to get towards that, to work towards. It's something just to be aware of if you're interested in that. All right, page 15 is a great little summary of the different documentation and records that you are responsible for keeping. It's kind of a handy one-page guide. Just some reminders up here about keeping your documentation current and up to date. I guess a lot of the other things that we've covered, UI and MUI, I think we've done a pretty good job of covering that. So just kind of reminder. What I really like here is at the bottom is this timeline that goes over, breaks it down into daily, monthly, and annually what you're required to complete and document on. So that's a great reference sheet there. Page 16 covers medication administration. So if you are going to be working with an individual that requires medication to be administered while you're working, then you must have medication administration certification. There are 3 categories of that listed down here, different levels. And so there are actually 3 different certifications that you can earn or achieve. And those are available through the DoD website. You can find where those trainings are available. There's also some third parties that offer those trainings as well. The certification is actually issued by DoD, and it has to be renewed annually. Just looking over to see if there's anything else that I want to mention. It's just if medication administration is a component, it will be listed in the individual service plan, and you will need to be documenting on that according to that plan. Just a few things left to cover in this handbook. So compliance reviews. So all providers, everyone is subject to a compliance review at least once during your certification span. So it doesn't mean that anything's wrong or that you're doing anything wrong. It's just simply required by rule. So you'll be contacted by a reviewer through DoD to have a review. It's very random when that happens. You're notified 90 days before that review will be happening. You'll receive an email from DoD about that review. So that's why it's very important to have your email up to date in the DoD system, because that truly is the only way that they communicate. So you'll be, as soon as you're notified from them, you will want to respond to them very quickly so that you have time to then schedule with the reviewer a time to actually have your review. They're going to come to you and review documentation and other training documents that you have. They will actually provide a list to you of all the things that they're going to be reviewing. So you'll have that to prepare ahead of time. There is a link here to get more information about this. We as a county board are happy to meet with you to prepare for that compliance review. We've had providers come into the office and we look over documentation to make sure everything is in order, there's nothing missing. We're always happy to do that, especially that first time. It can be a little intimidating. So after the review happens, you will receive some kind of response from DoD. If there's no citations, you'll receive a letter signifying that everything's fine. If there was anything that they found that was a concern that wasn't quite in compliant with rule, you could receive a citation for that. And that would just mean that you need to submit a plan of correction within 14 days of how you're going to fix that. and you'll want to implement that right away. Page 18, this is a long ways away. I'm just going to briefly touch on it because you will not remember, but in 3 years, you will be required to recertify. Certification is valid for 3 years. So you will receive an email from DODD notifying you that you are within 90 days of your certification expiring. You'll want to get working on that as soon as you receive that email, because by rule you should submit everything required for renewal certification at least 45 days in advance of your expiration to avoid a gap in your ability to bill. Again, links here to read more about this. Here's a list of some of the things that you're going to be required to have for recertification. It's not nearly as much as what you had to provide during your initial certification. One big difference, though, is that there will be a fee of $125 for that recertification. So, moving on, this is only for those of you who are providing that participant-directed service and are working with GTI independents. If that does not apply to you, you can skip over this section. There's just some kind of reminders about it, how it works. GTI handles a lot of the paperwork side of things for you. They are processing your timesheets, issuing your paychecks. And so because of that, they are keeping a portion of your rate to pay for those services that they are providing for you. This just kind of breaks down how the process works. I'll just let you read over that. If that applies to you, you can reach out to us for questions about this. And then also there's a phone number on that page 3 to reach out to them if you have specific questions and their specific requirements, which are quite different than DODD's. The last few pages of this handbook, I'm just going to scroll through. They are a list of frequently asked questions that you can refer back to if there's questions you have or want to learn a little more. You can refer here. As always, though, please reach out to us with anything that we can help with. We're always happy to help. So just keep kind of scrolling fast. It'll be there for you when you need it. And now we're going to turn the time over to Amy for our next part.
Yeah, thanks, Kathy. So we're going to dive into some documentation templates. So as a provider, you're required to document on any service that you're providing. So we've got several of the main common services and templates here to review with you. So the first one you see up top, you'll always see that service name. It's Homemaker Personal Care, also goes by HPC. So then right below that, you're going to have consumer name. That's where your individual or client name goes. Location of service. Typically that's at home, but if you're going out and about in the community or medical appointments, anything like that, you can kind of list that below. Medicaid number is going to be that individual's Medicaid number. If we go over to the right there, you're going to put your name for provider name. And then provider number, that's your 7-digit DODD contract number. If you're from Butler, reside from Butler, it most likely is going to begin in 0906. If you're from surrounding counties, that could be different, but it is that 7-digit DODD contract number. So one form represents a month. You see the days of 1 through 31. So you're going to put the service month and year. So let's just pretend we're going to put October of 2023 in there. And then we go down to the actual graph area. That's where you're going to time in, time out. So reminder, you're still doing that EDB. You're doing that time in, time out with them. And then on the dot sheet, you're going to want to also reference when you are in and out. So let's just pretend on the 5th of October that your time in was 9 a.m. So you click 9 a.m. in that box. Time out 3 p.m. And then right below in that third section, there is number of units. So there's a slight little bit of conversion of math there. It's not bad. Just always keep in mind that 1 unit equals 15 minutes. So there's 4 units in an hour. So if you work 2 hours, you times that would be 8. So you're always going to times that by 4 because there's 1 unit for 15 minutes. And then right below there, number of individual sharing supports. If you're always just working with one person at a time, you can leave this blank. If you're working with multiple people, that's where you're going to want to put those ratios in there. So the next part of this document is supports and plan duration frequency. So this is a great time when you're meeting with that SSA individual, the team, to review that plan, get it finalized, sign off on it. Definitely go into detail, ask questions, just make sure you fully understand, what supports that you're needing to provide for that individual. Those are going to be woven in that plan and then in the assessment. It should also mention that you are responsible and the frequency. So those services are going to be spelled out here. As you'll see, there's not a lot of room. So, you can be somewhat short and sweet in there. If it's, for example, ADLs, assisting with the shower, meal prep, if you're going out in the community, that type of thing. You would be either typing or writing those out there and then Xing or checking on the days that you're providing each of those services. So again, just get with the SSA on, just making sure you're fully aware of what's in that plan and what you're responsible for providing. Desired outcomes, a whole separate section. The other supports are more, like daily, more often supports. The outcome is more of an annual goal. So every individual has at least one. Some individuals have several. There is a very specific section in the plan for outcomes. So with that outcome, there's going to come either action steps or experiences. You might see that listed different ways there. But really, those are steps to get to that achieving that goal that an individual has. So again, get with that SSA, or you can look at the plan yourself and find that section, find out what those steps are. You would spell those out there. Again, X or check on the days you're working on those. Also, there's going to be a frequency with those as well. So you're going to see the outcome, the steps, that who's responsible, and what frequency this should be worked on. So that will give you a better understanding of it's weekly, monthly, like what that looks like. Down below, there's a section of a lot of lines. Really, this is your space if you need it to list kind of any oddities or really any extra space for anything you need at all, since there's not much up top there. So if an individual refuses services, this is a great spot to put it. Service location, if you're going out in the community, jot it down here. Anything you need to jot down for your reference, feel free to use this section for. And on a side note, I know Kathy mentioned this earlier with Excel. You can tamper with these documents. They can visually look however you want them to look. Just make sure you're keeping all the components in there because those are all in there per role. But if you want to expand those sections so you have more room to type or write or make it look different, put in Excel, anything like that, you're more than welcome to do that. Okay, and then you're going to sign, initial, and date at the very bottom. And then that completes your HPC document. So that if you're providing HPC, that's going to be the main document you're going to want to document on every time you're providing that service. Okay, then we're going to skip over to transportation. So this one is specific to HPC transportation. There are 2 types of transportation. HPC is going to cover trips out in the community. That could be grocery store, park, theater, whatever that looks like, medical appointments. It is the mileage that you will bill if you're authorized for that. So we'll dive into this form. The top's going to look kind of similar there. You're going to put the consumer name, consumer Medicaid number, so that's the individual you're working for, their Medicaid number, your license plate number. Again, your name, your 7-digit DoD contract number, service month and year. And this one is pretty nicely laid out, pretty simple form. You're going to date when you took that trip, did those miles. You're going to do the origination, destination points. Where'd you go? What'd you do? Kind of a brief description there. And then you're going to list the total number of miles driven. And that will go there. No odometer readings. You don't have to worry about that. Just the total number of miles. Okay, and the number of individuals being transported. If you're just working with one, you'll put 1 there. If it's several, you put how many folks that you're working with, and then you're going to put your initials in that last column. And then the signature down there at the bottom, that would be your signature as the driver. And there's a second page to this. So this is only required for modified vehicles. So if you have a permanently modified vehicle, like a lift ramp installed, fasteners, that type of thing, you will need to complete this. If you do not have a modified vehicle, completely disregard this page. You do not have to fill it out. If you do, then you're going to date, and then you've got to do a pre-trip inspection. So you'll see the few things you got to check for, initial on those. If you see any issues, you're going to want to note them and actions that you took to, to remedy, know what's going on there. Okay, and so we talked about two types of transportation. That was HPC. This one is non-medical, also referred to as NMT. This is very specific to taking individuals to day program, employment, to their job, if they do post-secondary education or volunteer work. So if it falls in those categories and you're authorized to provide this specific service, you're going to use this form. So up top, you're going to put your name and your provider, again, your DoD contract number, vehicle license, plate number, month and year, and then come down to the body of the document there. You're going to date, initial, your pickup time, drop-off time. Again, if you have modified vehicle or not, you're going to put a yes or no there accordingly. Billing units, NMT is per trip. HPC was mileage, NMT is almost always trip rate. So whether you're doing one trip with them, two trips, whenever they're in the car with you, that would be the trip. Passengers, you're going to list all the passengers that are included in the vehicle at that time. Again, there, that would be the individual's Medicaid number. And then you are required per role to list if there are other paid staff or riders in the car at that time. Okay, down there below, you're going to sign an initial. And same type of thing as the HPC transport. This second page is only if it's the permanently modified vehicle or vehicles equipped to transport 5 or more passengers. So if that's not the case, please feel free to disregard this one. If it is, you will have to go through these daily checklists and check yes or no on all this. Okay, and I think this is the last one for the documentation template. So this is shared living. So this is specific to, living with someone, residing with them permanently. They have to have an IO waiver, but it's called shared living. So if you're certified for that, this is the doc sheet you'll want to use. You'll see it looks a little similar to HPC, but there are some components taken out. You don't have to do that time in, time out unit. Just because shared living is a daily rate. So it's a 24/7 service model. You get one daily rate for it. So there's no need to log the time in, time out, or convert to units for this one. So up top, consumer name, that is the individual you're working with. Address of service, wherever that may be, the individual's Medicaid number. And again, provider, your name, your contract number, and it's a little redundant. Service month and year. So again, this one sheet represents 1 month. So very similar to what we touched base with on the HPC sheet, same type of deal here with the support section. Work with that SSA, that individual, that team, make sure you're well versed with that plan and assessment, what you're responsible for in there, what services you'll be providing, what those needs are. That's stuff you're going to want to list out here. Whatever that looks like, it's going to be very individualized, very person-centered. So list those supports that you'll be working on daily, since this is shared living. You're going to list those there. Shared living is a snapshot, so you don't have to list, don't feel like you have to list like 10, 20, 30 things there. It's really just a snapshot of the main types of supports and services you're providing daily. So pick 3, 4, 5 of those. Make sure, again, they're in the plan. And then X or check on those days that you're providing each of those services. Same thing with outcome. It's going to be in that unique outcome section. So you're going to want to take those experiences, those action steps, whatever that may be. If you're listed as responsible, spell those out. And then, look at that frequency again to see how often you need to be, working on that with the individual. Again, you're going to X or check on those days that you're working on those. Same as HPC on this one, you can leave this blank where the cursor is there if you're only working with one person. If it's several, you're going to want to put how many folks there. And same situation with the lines down here. So it just gives you some more space if you needed to jot any notes down that you may need that didn't quite fit up top there. And at the bottom, you're going to sign, initial, and date. And again, that is for the shared living. So just make sure whatever you're doing that you're authorized to provide that service and that you're using the proper documentation form. It will list the name of the service at the top of each one.
Great. So we are going to now switch over and show you where you go to do billing. This will be a great chance for you to even go along as I go. You could try doing it on your own computer, practicing it while you're here. Well, I don't know, Amy, if you want to, if I scroll down, you want to share with them about subscribing since we're here.
Sure, that'd be great. Yeah. So if you are on the dodd.ohio.gov page, you don't even have to be logged in at this point. If you scroll to the very bottom, there's a blue banner and you'll kind of see Kathy scroll over there. There'll be a subscribe. If you click that, it's going to have you enter all of your information, your email, your name, anything, and asterisks required there. And there's lists. So there's listservs, there's newsletters that DoD puts out. These are super helpful to kind of keep you in the loop because rules change, things update all the time. As a provider, you're responsible for keeping up with that. So a few that we highly recommend are the Memo Monday that gives a lot of new updates and guidance, and then rules notification. So anytime rules update, change, or they're up for renewal, they're going to list that, and you'll just get to see the draft rule and see what's changed. Those are two really good ones, although all of them are pretty great as well. So you can check whatever you're interested in, sign up there. Also on a side note, we do a bi-monthly provider meeting, and we try to also, hit point on, a lot of the updates and rule guidance and that kind of stuff in those too.
And we'll point out here while we're down here, also down here is where you can go to get more information about medication administration for certification. So if you scroll down, you'll be able to go there and follow the links to get more information and to find out if there's trainings available for that around us. All right, so we're here again at the dodd.ohio.gov. Come to this page on the top banner. This is how you log in for billing. So you'll be clicking on the login where the little person is, and you'll be entering in your Ohio ID and your password that was created during your initial certification. It's an important one. You're going to use it every time you're billing. So have that in a place you can easily find. For me, I'm lucky enough it saves it for me. So if you're able to make that happen, that would be really good. It's also really helpful if you bookmark this page to your browser so that you'll be able to get to it quickly, because you're going to be using it every time that you want to submit billing. You'll be hitting the login button after you've entered in your login information. It takes just a minute while it pulls your account up. You have to agree to this page to continue with being logged in. And again, just waiting for just a few seconds. Then you'll come to your home page. Yours may look a little different than mine. That's okay. What we're looking for here is the applications menu. So up here on this blue banner, I see the application. So when I click on that, it opens up some tiles, blue squares. And again, yours will look very different than mine. I have more with the permissions that I have. So the one we're looking for billing is this one right here called EMBS, which stands for Electronic Medicaid Billing System. So we're just going to click on that, and it brings you to this kind of generic gray and white screen. Over here on the left is the menu to be able to access the screens that we'll need to do your billing. So over here, you'll see these little pluses. By clicking on them, it opens up another menu. So we're going to go to the billing submissions line, hit that plus like I just did, and you'll see single claim entry, the very first line. We want to click on that to get the screen that you might remember from the handbook. We have this screenshot there for you. So I'll just go through each line of this billing screen. This is exactly how you submit your billing, entering all the information here that's required, and then hitting submit is the way that you submit a claim to be billed, to be paid. All right, so the top line, today's date autofills for you. You can leave that the way it is. Your contract number is that 7-digit number. in Butler County, as Amy said, often starts with 0906. The Medicaid recipient number. So the recipient is the individual you're working with. So you need their Medicaid number. If you do not have that, the SSA can get that for you. It's a very long number, like maybe 12 digits. The recipient first initial. So this is the individual's, your client's first letter of their first name. Put that there in that box. Then you need the first 5 letters of their last name. So you'll put that here in this box. Make sure you have 5 letters there. Date of service. So this is the day. You'll refer to your doc sheet to help you as you're filling this out. You'll refer to that to find what date you provided your service. And you'll enter that here. You'll do 1 page, 1 screen per day of service and per type of service. So each day is going to require a new screen to be filled out. So you're going to enter in the first day you're going to bill for here. And remember, you also have 350 days to go back and bill for. So you have time to get those in if you don't get to it right away. So there are a couple components that vary based on what type of service you're providing. So service code, units of service delivered, and down here at usual customary rate. Those 3 things depend on what service you're providing and the individual that you're working with. So we can get those for you once you are authorized to work with someone, because they are entered into what's called a pause, and we've provided instructions in your email of how to view this to get those codes, but we are happy to provide those to you as soon as you are authorized to begin working. So service code, you'll have 1 service code for, say, HPC, homemaker personal care will be a certain code. Shared living would be a different code. Any transportations, so there's a code for HPC transportation. There's one for non-medical. So you're going to put in the right code for the service that you're billing for. And based on that code, that then determines what you need to put in the units of service delivered. And I want to mention too, sorry, the service code is a 3-letter code. It's 3 letters that will go there. So going down to units of service. So if I am billing for homemaker personal care, you'll remember from those doc sheets that units is 15 minutes. So you're going to be, and you should have it documented right there on that little box. You can transfer that right over the number of units that you computed. So if you worked 4 hours, you take 4 hours times 4, and you'd put 16 here in this box. If your service code is for transportation, HPC transportation, you put the code here. Your units of service delivered would be your number of miles. So you'll be listing the miles, again, transferring it straight from your doc sheet. You'll put that there. Non-medical transportation, you put the code for that here. Then your units of service delivered would be your trips. So either 1 or 2, probably for most days, you're either doing a one-way or a round trip, most likely on a given day, unless you just drove all day. Then another code is shared living. So you put shared living here, the code for that. Units of service delivered would be the day. So it will be 1. Shared living would be a unit of 1 because it's per day. And you're billing this day of service. So it's 1. All right. So moving down, group size is the number of individuals you're working with. So if you're working with just 1 individual, you put a 1. Staff size is the number of yous. So probably most likely always going to be 1 unless you're working with someone else. So put 1 there. Service county is the county that the individual you're providing service for is authorized. So this would be Butler for us. You'll select that from the menu. And then down here, usual customary rate. This is the other line that varies based on what you're putting in here for service code. So based on the service code, that will determine what your rate is going to be. So if you are billing for HPC, homemaker personal care, you would be putting in the amount for the 15-minute unit So that will say it's $5. So you put the 5 in the first long box. And again, this can vary. So you'll want to make sure you get this from us based on the waiver and the individual and their needs. And rates change too. So make sure you check with us on this. But for example, we'll say for today, $5 goes here in this long box. And then there's a tiny decimal point, and then the cents go in the second box. So if it's $5.49, you'd put 49 cents here in the small box. So that's how you would put that in. If you're putting in mileage for HPC transportation, because you have your code here and you put your miles here, you're going to come down here and put 60 cents in for the mileage, because that's the current rate of this time of the video. So 60 cents goes here in this small box. If you're doing non-medical transportation, you're going to be putting in the trip rate here, the dollars in the long box, the cents in the small box. Shared living, the same thing. You have your service code and your units correct. Your rate is going to be much different because it's a rate for the whole day. So you'll be putting in your dollars and then your cents in the small box. The last 3 boxes are for a very kind of rare situation. So I'm going to skip over those. You would be notified by our billing department, our business department, if this applies to you, and you'll know what you should be putting there if it applies. All right, so once all these other boxes are all filled in, everything looks good, you'll be hitting submit claim at the bottom here. You'll receive a little message up here in green that says something like your claim has been submitted. It's very small. And then also many of these boxes here will clear out. So then you could actually go right in and start putting in another claim for either another service type or for another day of service. You would just keep going, filling in everything, hitting submit, then doing it again. You could, do this many, many times, as many as you needed to or had time for. You could submit. All right. So one more thing while we're in this billing app, I wanted to show you over here. If we go over here to this menu again that we started at, where we went to billing submissions, the next row down is called reports. If you click here on this reports, and you see here this provider weekly reports, this is where you can go and get a report of the billing claims that you submitted and that were being processed for a pay period. So it lists here each Wednesday of the payment processing week. And if you have a claim that week that was processed on that Wednesday, you would have a report here. When you hit view, a menu will, a file will open up, and in there will be a couple of different files or documents. You'll have everything that was processed, what was accepted, how much you'll be paid. If there were any errors, there will also be a report there that will list anything that was denied. So you'll be able to see that. It will list the reason so that you can figure out how to fix that, find out what happened, and be able to resubmit that. And we can help you with that. There is a guide available as well that can help you resubmit and fix that. All right, so that is it for our billing submission, billing claims. That might be actually all that we have. Amy, is there anything else that we wanted to cover today?
I think so. I just want to say welcome, and we look forward to working with you, and don't ever hesitate to reach out to Kathy or I. We're always here to help with any questions you might have. So welcome aboard, and we're really excited to have you.
Great. Yep. Same here. Good luck with everything.